International collaboration is especially important in rare vascular diseases because some diseases are extremely rare and can be difficult to collect data even with multi-institutional collaboration within the US. For example, carotid body tumors are quite uncommon in the US, but are fairly commonly seen in the high altitude regions of South America. And we learn from our international colleagues about managing diseases that are rare to us, but might be more common to them. So the Vascular Low Frequency Disease Consortium, or VLFDC, is a model for institutional collaboration to examine uncommon vascular diseases. One of the most important things that we do is that we collect standardized data from the multiple institutions that participate. So when everyone uses the same definitions for variables, we speak the same language, and that enables us to analyze the data and make strong conclusions about how various management strategies might influence the outcomes. So something as simple as making sure that everyone who contributes the data measures the size of the aneurysm the same way can change the recommendation for the size at which an aneurysm should be repaired. So this is why we make very detailed data dictionaries that define each variable in great detail. And we also make it very easy for everyone to participate. Yeah, so in general, it has been very easy for most of our international collaborators to participate. However, recently there have been very strict rules instituted within the European Union or the EU that make it very difficult for those collaborators to participate. So even though within the VLFDC, we go to great lengths to make sure that all the data is de-identified, we do not even collect dates. So we don't collect dates of surgery, we don't collect dates of diagnosis. We make sure that everything is de-identified. Even for participants in the EU, sharing that kind of data is not allowed and can be subject to large fines. So that is one of the problems that we're trying to overcome. Yeah, so one of the most interesting studies that we've done is on renal artery aneurysms. We were able to collect data on 865 renal artery aneurysms in 760 patients at 16 institutions. And the historical recommendation for repair of renal artery aneurysms has always been when they reach 2 centimeters. But we found in our study that all the ruptured renal artery aneurysms were greater than 3 centimeters. And as a result, the conclusion of this study was that the recommendation for repair of asymptomatic renal artery aneurysm should be at a diameter of 3 centimeters. And this study formed the basis for a subsequent evidence summary, which has fairly significantly influenced the literature on recommendations for treatment of renal artery aneurysm.